Hi, I'm Dr. Rob. You just had an oral surgical procedure. It's important to remember that everyone's recovery is a little bit different. What we've done is review the most current evidence-based practices to give you the key do's and don'ts that will help optimize the healing. It's very important that you follow the general instructions we're about to go through. We'll also provide you with special instructions that are specific to your case. Before you leave the clinic, we'll make sure your bleeding has stopped. We may ask you to continue biting on gauze until you get home and you've had a chance to relax. At that point, you can discard the used gauze. It's normal to experience some bleeding over the next couple of days. So we'll provide extra gauze for you to take home with you. If your bleeding starts again, take one piece of gauze, roll it into a tight pad, dampen it slightly so it's more comfortable on the wound, and place it directly over the bleeding site. Bite down firmly for about 15 to 30 minutes. You may need to repeat this a few times. For this reason, you may want to purchase extra gauze from your local pharmacy. A good tip is if the bleeding continues despite several attempts, try using a damp tea bag. The natural tannins in tea can help blood clotting. For as much of the first 24 hours as possible, use an ice pack on the outside of your face. 20 minutes on, 20 minutes off. This can help reduce swelling. Always wrap the ice pack in a clean cloth and avoid placing it directly on the skin, especially while you're still numb, to prevent any cold burns. Your dentist will recommend a pain relief routine suited to you. This usually includes over-the-counter medications such as paracetamol and ibuprofen. You may also be prescribed additional medications for pain, infection, swelling, or inflammation. Please follow the instructions given carefully. Stay hydrated, but try not to swish water or mouth rinses around your mouth in that first 24 hours. This helps protect the blood clot that begins the healing process. After 24 hours, you can start rinsing gently with an antiseptic mouthwash, such as Savicol, Curacept, Curafox. If you're allergic to chlorhexidine though, or unable to tolerate it, alternatives include hydrogen peroxide rinses like Peroxyl, or simply warm salty water. It's important to rest as much as possible. Early on, try not to lie completely flat, keeping your head elevated, which will reduce swelling and bleeding. Avoid all exercise for the first few days, and hold off on any strenuous activity for at least a week. This gives your body the best chance to focus on healing. Plan for a soft or liquid diet during the first few days. Aim to maintain a balanced diet and gradually return to normal eating as soon as you feel comfortable. Suitable foods in the first week include soups, yogurt, pureed vegetables, eggs, and jelly. Do not drink alcohol if you are prescribed painkillers or antibiotics. You should also not vape or use straws or smoke in those first few days. These actions can dislodge the blood clot and delay healing. If your procedure was completed under sedation, you may have additional instructions. We'll go through these with you separately. If at any time you have any questions or concerns during your recovery, please don't hesitate to contact us by phone or arrange an in-person review. We're here to help you heal comfortably and safely.